All right, let's talk about something that tells a huge story about your health, but a lot of us don't really get what it means. We're talking about your blood pressure. You know the drill, right? You're at the doctor's office, maybe even one of those machines at the pharmacy. The cuff gets tight, then it lets go, and boom, two numbers pop up on the screen. 132 over 85. Is that good? Is it bad? What is that number actually telling you? Okay, let's dive in and make sense of it all. So, at its simplest, blood pressure is pretty much exactly what it sounds like. I want you to think of your body's circulatory system like a really complex plumbing system. Every time your heart pumps, it sends blood rushing through those pipes, your arteries, to get oxygen and nutrients everywhere they need to go. That push, that force against the walls of the pipes, that's your blood pressure. Okay, so when you get that reading, it's not just one number, right? It's two. You've got a top number and a bottom number. And each one is measuring a totally different moment in your heart's cycle. Let's break that down. So that top number, that's your systolic pressure. It's the highest level of pressure, right at the moment your heart contracts and beats, pushing blood out into your body. It's the maximum force. Then you have the bottom number, your diastolic pressure. This is the pressure in your arteries when your heart is at rest, in between beats. And here's something really important to know, especially if you're over 50, that top number, the systolic one, is a huge indicator of your risk for cardiovascular disease. So, where do your numbers actually fit in? Well, this chart is basically your roadmap. According to the American Heart Association, a normal reading is anything less than 120 over 80. Then you hit elevated, where that top number is starting to creep up. After that, you're in the different stages of hypertension. That's the clinical term for high blood pressure. And pay attention to the word or here. For stage 1 and 2, if either your top or your bottom number is in that range, you're there. And way down at the bottom, you see hypertensive crisis. That is a flat-out medical emergency. So why do we care so much? What's the big deal if the pressure is a little high? Well, think about it like running a car's engine in the red all the time. For a little while, it might be okay. But if that pressure is consistently too high for years and years, that constant strain causes some serious wear and tear on your body. And this is where it gets really serious. That constant force damages your arteries. It can cause tiny tears where plaque can build up. That's called atherosclerosis. It forces your heart to work way harder than it should, which can eventually lead to heart failure. High blood pressure is also one of the biggest causes of strokes and kidney failure. It can even mess with your vision and your sexual health. The damage is widespread, and it happens slowly over time. And here it is. This might be the single most important thing to understand in this whole explainer. You usually don't feel high blood pressure. There are no warning signs, no symptoms telling you that something is wrong while it's quietly damaging your body. This is exactly why it's earned the nickname the silent killer. And it's why you can't just wait until you feel sick. Regular monitoring is absolutely crucial. Now, the big exception to that no symptoms rule is that hypertensive crisis we just talked about. If your blood pressure spikes to a dangerously high level, you might suddenly get hit with these severe symptoms. We're talking a terrible headache, chest pain, shortness of breath. If this ever happens to you or someone you're with, this is not a let's wait and see moment. This is a call for help right now situation. It requires immediate medical attention. Now, we've talked a lot about high pressure, but what about the flip side? It turns out having blood pressure that's too low, called hypotension, can also cause problems. If the force is too weak, your organs, especially your brain, might not be getting enough blood flow to work properly. And here's a key difference. Unlike high blood pressure, low blood pressure often makes itself known. You might feel dizzy, lightheaded, nauseous, or just incredibly tired. You could even faint. And that, of course, creates a huge risk for getting injured in a fall, especially for older folks. In really severe cases, that lack of blood flow can even lead to organ damage. Okay, we've gone through the what and the why. Now we get to the best part, the how. Because here's the good news. There is so much you can do to take control of your blood pressure and your heart health. This is the empowering part. First things first, let's be real about what you're working with. There are some things you just can't change. Your age, your family history, your genetics. Those are the cards you were dealt. But look at that column on the right. That is a long list of things that are absolutely within your power to change. Your diet, how much you move, how you handle stress, your daily habits. This is where the real power lies. And here is your game plan. It all starts with the basics: what you eat and how you move. A diet full of real foods, fruits, vegetables, lean protein, and getting your heart pumping with regular cardio. That goes hand in hand with cutting back on things we know are trouble, especially sodium. Why is salt such a big deal? Well, when you eat too much sodium, your body hangs onto extra water to try and dilute it. More water in your system means more blood volume in your arteries, which directly cranks up the pressure. Then it's about the big lifestyle habits. If you smoke, stopping is the best thing you can do. Limiting alcohol helps too. And finally, finding ways to manage stress and keeping a healthy weight ties it all together. Every single one of these steps makes a difference. So when you boil it all down, after everything we've looked at, it really comes down to this simple, powerful 3-step mantra. Know your numbers, because you can't fix what you don't measure. Monitor your own health, be an active participant. And most importantly, talk to your doctor. Work together to make a plan that is right for you.
You know, every single time your heart beats, it's contributing another word to the ongoing story of your health. Those numbers on the screen, that's the language your body is speaking. So the only question left is, are you listening?